Over the past 10 years working with adults with ADHD, this is by far the best way to eliminate your ADHD symptoms this year. And so the very first thing that I will do, and what you should be doing, is you need to investigate what is the root cause of your ADHD symptoms in the first place. And the very first thing that you should do is really running some labs to investigate really what's going on. And I usually like to start with looking at a full micronutrient panel. Now, the problem is a lot of insurances don't cover a lot of different micronutrient tests. So ones that will be covered by insurance, this is a good list to at least start with, is vitamin B12. A lot of times you can get that tested by your insurance. Also running ferritin, as well as looking at iron and total iron binding capacity. Those are things that can be very common to see deficient with people with ADHD. And then on top of that, some other ones you could be testing for is looking at vitamin D3. Sometimes that can be tested by insurance. And then some other additional ones that might not get it covered by insurance, good to test for, is looking at magnesium, zinc, as well as looking at vitamin B6. This is a really good starting point to see if you're deficient in any of these different micronutrients, because all of these are so vital for helping with the neurotransmitter pathways, things such as like dopamine, serotonin, GABA. And if those are deficient, it makes it very difficult to tackle and eliminate your ADHD symptoms. Now, some other additional things that I would suggest. Now, this really depends on your health background and your history, because every ADHD person is different. Some people have type 2 diabetes, some people have cardiovascular issues, some have autoimmune or thyroid issues. Whatever it is, if you have additional other conditions, you should be investigating that. Or if you suspect that you might have type 2 diabetes or a thyroid issue, you should run a full thyroid panel, look at insulin levels, look at hemoglobin A1C levels, look at glucose levels, look at all those things that could be possibly contributing to your ADHD situation and your symptoms. Because I guarantee you they're making them worse because they're not very well managed. Now, another thing to look at is also look at hormones. Hormones definitely does impact the ADHD brain significantly. So it doesn't hurt to look at a full hormone panel, to look at estradiol, progesterone, testosterone, DHEA, also even looking at for adrenal insufficiency syndrome. And how to test for that is looking at your cortisol levels today to see if it is dipping, because if it is, it does impact your focus, does impact your motivation and drive. It can also impact your sleep and your stress. So these are really good things to start off to really check to see if these are off. Now, once you have established that and seen what is off, another thing to also look out for that is so common with people with ADHD is having severe digestive issues. So if you are dealing with any kind of gassing, bloating, constipation, diarrhea, or acid reflux, any of those things that are digestive related, is very highly likely that you are not making and producing enough dopamine or different neurotransmitters, because a lot of our different neurotransmitters are made in the gut. So it's always a good idea to making sure to test for also, why do you have those digestive issues? And some good things to look at is look at your gut microbiome. You can test for that. Also look at your stomach acidity. Is it very acidic? Is it very alkaline? Is it not producing enough acid to help break down your foods? This can be the contributing factor of your gassing and bloating situation, and many other things that could be contributing to it. Also test to see if you have candida overgrowth. That could also be disrupting producing and making a lot of these different neurotransmitters that are impacting and causing a lot of the different ADHD symptoms that you are experiencing. Now, once you have investigated and run these labs, now the very first step that I always like to look at is first eliminating before replenishing. Somewhat I actually do it at the same time, but it's always good to eliminate what is contributing to the issue. So for most people, it's going to be your diet and your lifestyle, things that you're consuming that are contributing to the situation. So if you eat a lot of junk food and not very many nutrients, and you find that you're deficient in some nutrients, you probably need to change up your diet. You probably need to be consuming a lot of things that are going to be contributing to helping replenishing your nutrients. And then of course, eliminating things that could be toxic. Now, other things that could be toxic is also your environment that you're breathing, the air that you're breathing in, or if you have mold exposure in your house. There could be several different things, but you do need to eliminate those things that are contributing to your situation. A lot of times it's going to come to diet, lifestyle, and the air that you breathe and the environment that you live in. Now, the next step, I've already kind of mentioned this, is you definitely need to start restoring what you found that is deficient from your lab tests. So when you find that you're deficient, there is a couple ways you can do this. Now, how I typically will do it is a combo of two things. One, I will, use supplementation at a high dose when I found that my patient is deficient in a particular area. But on top of that, I will make sure that I'm also including foods and nutrients to replenish so that my patient does not have to rely always on supplements. Supplements are great. They're a good way to get things going, but it isn't a long-term solution. So not only are you using supplements, but you're also using the proper nutrients that you're deficient in. So if you're deficient in certain B vitamins that you found out, or magnesium, make sure you're go to a list, go on Google and type in what are the high foods in that type of category and start making those adjustments accordingly. Now, a lot of times what I do find that tends to be really deficient with people with ADHD is they are not getting enough protein, amino acids in their diet. So that's usually going to be the case in most people that I usually will run these tests, is find that they're deficient in a lot of different amino acids, in which these amino acids also are what help build and make a lot of these different neurotransmitters, things such as like dopamine, serotonin, and GABA. Now, once you have restored the body of its proper nutrients, there's still usually more work to be done. But I always want to make sure that we're not doing things too extreme, because it could shock the body. So once you've discovered what is out of balance and then you've replenished it, now you're ready to do things a little bit more intense, which is to finally start detoxing the body. The body definitely needs to be continuously detoxified. Now, there's many ways to detox the body. A lot of times it's just doing more different types of diets that restrict all sugar and maybe just only doing vegetables for a while and allowing the body to detoxify. Or there's also fasting, intermittent fasting. So there's a lot of different styles, but usually it requires doing a long duration of at least like doing something for a month or 6 weeks, doing high intensity of like fruits and vegetables for a while, eliminating all inflammatory foods, or also doing an alternate day fasting. One of my favorites is where you every other day are doing fasting, but you have to build up to that. You start with doing some intermittent fasting of where you fast for 16 hours a day, then you go to 20 hours, try to do a fast once a week for 20 hours, then to 24 hours, then eventually 36. And then you can build up to doing every other day fasting, which is just one of my favorite ways of actually detoxifying the body. Now, why is this so beneficial? Because one thing, you're cleaning out the system. It also does get rid of old dying cells, especially when it comes to fasting. It's what we call as autophagy. And getting rid of those dying cells, rust in our body, it allows for stem cell regeneration to increase. What is stem cell regeneration? It is essentially just giving us new cells, brand new cells, not only for our muscle tissue, but also for our brain cells, stomach, heart, all of it. And that is where you can start seeing benefits not only for your ADHD and eliminating a lot of the ADHD symptoms, but also for your overall health. Now, I get this a lot of information. You should download my ADHD free guide in the description below that goes over a lot of this different stuff that I'm just talking about. Now, another very important thing that you have to do is that when I am working with a patient, if they don't do this, everything that you're trying to do and implementing of what I just talked about makes it very difficult for it to work. And I'm talking about stress. Now, stress is a very common thing amongst adults with ADHD. And if you don't start eliminating the different stressors in your life, it makes it very difficult for your body to heal. So if you're in a very toxic relationship or in a work environment that's very toxic, or something that is constantly nagging you all the time, you need to start eliminating it. And as hard as that might be, if you don't do that, it makes it very difficult for your body to heal. So I should probably put that at the beginning, but that is something by far you have to put a high emphasis on. Otherwise, you will not see the results. Because once you do eliminate that and you're implementing all the good nutrients, everything, then you find that your body's starting to heal. You're starting to eliminate the ADHD symptoms you've been experiencing all your life. Those are the key elements that you need to be implementing. Now, the next thing that you need to be doing is always analyzing and adjusting what needs to be perfected. So I always like to retest and see, okay, what else needs to be adjusted in my patient's treatment plan. And even for my own ADHD, I'm always analyzing and adjusting and testing to see where I can get even better results. And so that's what really is required. Now, there's lots of testing out there, and I know it's a lot of information. So if you really want to discover how I do this with my patients and clients to eliminate their ADHD symptoms, then you should watch this training next, where I dive in more deep about the testing and the labs that you could implement to eliminate your ADHD symptoms. So watch this video next.